for me, okay? Welcome to the stream. All of this week, we are doing shows, running discussions that have been inspired by you, our viewers, and our online community. Today, have a look here, back on my laptop here. This is what we all often ask you. Is there a story or issue you think we should cover? And I'm going to scoot down here so you can see Clovis Rondinelli. And Clovis says that the advancement of government surveillance on its citizens, the same rhetoric and euphemism used on war on terror to justify unprecedented personal data gathering of its citizens, is being developed around COVID-19 to track people's movements. So we want to discuss in our show today, is being personally safe and healthy worth giving up your personal data? Do you have to do that? If you're on YouTube, jump in the comments. Let us know your opinions and your takes, your experiences. We'd love to include them so you too can be in the stream. Let me introduce you to the guests who will introduce themselves to you. Hello, Dr. Anu. Welcome to the stream. Tell everybody who you are.
Thank you for having me. I'm Anu Dillon. I'm a physician at Harvard Medical School and formerly served as an advisor to the president of Guinea on managing Ebola.
It's good to have you in the mix. Hello, Rahul. Welcome to the stream.
Thank you for having me. I'm Rahul Mathan. I'm a partner with Trilegal. I head its technology practice, and most recently, I helped the Indian government with its Arogya Setu contact tracing app.
Looking forward to hearing about that. And Irene, welcome to the stream. Tell everybody who you are. So we will get Irene to introduce herself again in just a moment. We're going to change her. I think she's muted at the moment. So
Hi.
We're going to bring her volume up. All right, take two. This is live, so we're going to do take two, absolutely live. Hello, Irene. Good to have you in the stream.
Sorry about
Tell
that.
us who you are.
Thank you for having me. I'm a senior researcher for the Citizen Lab. We are a cybersecurity and human rights research lab based at the University of Toronto in Toronto, Canada.
Great to have you all of you guests. I'm going to start with an Al Jazeera online show called Start Here. They looked at surveillance during this era of a global pandemic and wondered how far is too far in terms of invasion of privacy. So I'm going to hand over to Sandra Gatharman, and this gives an idea of what is out there to help us track COVID-19.
Want to fight COVID-19? There's an app for that. Facial recognition, GPS, Bluetooth, they make it easy. Cameras and drones keep an eye on us too.
This is a kind of watershed event. Surveillance is really spreading everywhere.
It's all about tracking people to contain the spread. But some want to know, who's policing the police?
Dr. Anu, as a doctor, in terms of technology and what's possible, what have you seen? What is exciting for you?
Yeah, from my standpoint, looking at it from the public health response, especially when we talk about contact tracing, the role for technology could be very big in that. Now, I'll preface by just saying that privacy is a first and foremost consideration, and the technology should not be used unless that could be assured. But from a standpoint of trying to contact trace, when people are moving around again as countries and as places start reopening, if somebody is found to be positive, it becomes very difficult to figure out who exactly was around them and who may have been exposed. You could be riding on a train with people. You're never going to know their names. You're never going to be able to figure out who they were. And that's where these apps that can at least detect whose phone has been close to that person can be very useful for finding the contacts. And then the second piece to that is finding them quickly. Right now, by interviewing people, it takes 2-3 days sometimes to track people down. But with apps, you can conceivably instantaneously notify somebody. And that speed of identifying a contact is critical.
All right, so you're making the case for why we need them. I'm just wondering, Rahul, you're working on an app right now. What are the apps that are out there that you've seen that maybe have informed you in terms of what is possible?
Yeah, so look, the app that we're working on is a plain vanilla contact tracing app. But there are so many other apps. You've got geofencing apps that will actually put you within an electronic box, and the moment you stray out of that box, an alarm is going to go off. You've got facial recognition technologies, as we saw in that video just now, that can identify you just based on the photograph. So if you're someone who's supposed to be in quarantine, they will use facial recognition to identify you. And there's a whole range of invasive technologies that are possible. I think the point is that whenever you use technology, you are making a trade-off. And sometimes when the situation is dire, the trade-offs that you have to make are more extreme. Now, the most important thing is once that situation passes, you've got to scale it back. And I think that's the critical thing.
Irene, what have you seen? What are you seeing out there that you can actually describe how it actually works? A layperson's idea. Because if we're being asked to put an app on our phone, and this is going to help us realize if we've been in contact with somebody who's got COVID-19, if we have COVID-19, and then we're in contact with someone, can you explain in a very accessible way how a tracking app might work?
Yes, so I think there are a lot of concerns with contact tracing apps. So first of all, it's not clear whether using contact tracing apps would be a lot more effective than manual contact tracing. So manual contact tracing involve interviewing people, and so the contact tracers are both, are detectives, but they're also therapists and they're also social workers, right? So they're able to get details as to where the person has been, particularly during the time when they were contagious. With contact tracing apps, there are a host of issues related to privacy, specifically concerns regarding surveillance. And it's not clear if the methods behind contact tracing apps would be a lot more effective than the manual contact tracer that I mentioned previously. And so some of these concerns include, for instance, vulnerabilities regarding the potential of hacking of technologies like Bluetooth or where contact logs are being stored. Apps are very invasive in terms of the requirements to install the app or use the app. So for instance, I've seen apps where it requires access to your camera to take photos and videos. It requires access to your memory card. So it's not clear that these functionalities are required to run the app, and therefore they risk infringing on users' privacy.
Let me share something with you, which was a very easy sort of a graphic so that you can see how one system may work. This is privacy first contact tracing. So your phone gives out random messages every few minutes. And then when you sit to somebody else, next to somebody else, your phones, as long as you're both on the same app, will exchange those messages. Both the phones remember what was said and heard in the past 14 days, which is believed to be the time in which you can actually get COVID-19 symptoms. And then if our little character here gets COVID-19, she sends a message to a hospital. Her phone then lets everybody else know who was in contact with her and also was on the app. And then you then can either self-quarantine, go to your doctor, etc., etc. That's a very basic walkthrough of how these apps or how an app may well work. I want to bring in Dr. Mike Ryan here. I know you will know him from the WHO briefings, and he had a briefing last week, and Dr. Mike Ryan explained why manual testing is not enough. The manual interviews are not enough. We need to use technology. Here he is.
Doing quarantine for contacts. We have seen time and time again in countries that have contained this virus and brought it under control without the need for massive lockdowns, have done it through the application of principled, human rights driven, but sometimes quite aggressive public health surveillance.
Dr. Rainey, there does seem to be some tension between doctors thinking this is going to help me and people who are very concerned about privacy and technology. Do you think this is the time to even be worrying about this?
I think definitely we need to take privacy into consideration. And, I in fact agree with everything that Irene just said. I think first and foremost, privacy has to be assured. I'm not a technologist, so I don't know all of the complexities that go into that, but certainly that needs to be assured first and foremost. Secondly, I would say we also need to build this on top of a system of manual contact tracing. So I'm not saying it's an either or equation. I think a lot of the discussion around this has unfortunately been either or. I think we need to have strong manual contact tracing systems in place. Now, the advantage that the apps can provide on top of that, especially if it's done in a way that's secure, like we're saying, it needs to be that way, then it can actually accelerate and augment what your manual tracers can do. And the two parameters that it really allows you that I think Dr. Ryan's referring to is, one is comprehensiveness of identifying fully all the people who are real contacts. Like I said, especially when things start reopening, now in many countries where things are locked down, the people around you in your house are your contacts. People are not really moving around. They're not going to work. They're not going to public places. When that changes, it's going to become very difficult to identify who all was around somebody and could have been exposed, number one. And then number two, the other thing that I think Dr. Ryan might be referring to is speed. So the challenge with COVID in particular is that people become infectious 2 days on average before they have any symptoms, and are most infectious actually the first day they have symptoms, according to the most recent data that we have. And so the challenge becomes, if I become infected and I get symptoms and I get diagnosed at a hospital, if it's taking longer than a day or 2 days to identify my contacts, they've probably already transmitted on to others. And so the speed becomes critical, because if you identify the contacts too late, transmission will have already happened.
Rahul, I want to put some questions to you from YouTube. Shranyash Kumar says that after COVID-19, these apps should stop. I know you're working with India on a you call it a plain vanilla tracking app. Does this app have a lifetime that goes beyond COVID-19? Is it a long-term app, or is it just for a short term?
So the app very clearly says that this is an app for COVID-19. In the app, there's no clear sunset clause, but the government has just released a data sharing protocol, which has a 6-month sunset clause. And it essentially says that in 6 months, we'll review it, but unless the review says something differently, we're going to shut this down in 6 months. So I think it's really important to actually have that sort of a sunset on the use of these apps. It at the very least gives people some assurance that it's not going to be used for long-term surveillance.
I'm looking here at the app. The app has its own Twitter feed. I'm just looking here at the app right now. Come over here on Twitter and then you'll be able to see it with me. And you're obviously very concerned about privacy first. There we go. All right. Did you know upon sign up, every user is assigned a unique, randomized, anonymous device ID? All communications between two devices and between device and service done using a device ID. No personal information is used for any communication. So you already are sensing that people are going to be quite concerned about this, Rahul. Should they be?
No, absolutely. Well, in normal circumstances, you wouldn't want an app that's picking up your every movement and figuring out who you've met, random strangers you've met while you went for a walk. And so if the app is doing that because we're in a pandemic, we've got to be very sure that whatever data we have to take under these circumstances, we take it in a privacy first way. So, we've got this device ID, so it's a random number and there's no personal information that's exchanged. And by default, all the information that it's collected remains on the phone. It's only pulled up if you turn positive. And we've got a rigorous data deletion protocol. So every 30 days, the data that's on your phone gets wiped out. Dr. Dillon said that you don't need it beyond 14 days, and we've just got another 14-day buffer, but every 30 days, that data on your phone gets deleted.
Let me bring in Albert Foxkhan. He's the Executive Director of the Surveillance Technology Oversight Project. He has some very deep concerns, despite what you said, Rahul, about these apps being on people's personal devices. Let's have a listen to him.
I'm deeply worried that governments are rushing to deploy unproven and invasive forms of surveillance technology in a rush to combat COVID-19. But a lot of these systems won't actually work. They'll divert energy from manual contact tracing, the only approach that does have peer review evidence that it's effective in combating the virus. But worse than that, we'll be laying a new framework for surveillance that will impact us for generations to come, a system that can potentially be used by law enforcement, by immigration enforcement, and by every other facet of government.
I mean, I'm seeing lots of concerns about privacy online. For instance, Elizabeth Rainey says, who owns the data? This is on YouTube right now. Thanks, Elizabeth, for this. Who owns the data that these apps collect? How easy is it for governments to hold onto that data beyond the COVID quarantines? Irene, do you have any stories that are actually sort of stories that are warning us about the dangers of apps and COVID-19 tracking?
There's a story coming out of Guatemala in which the government has proposed a contact tracing app that will retain data, I think, up to 10 years. So it could potentially be, well after the pandemic is over. And if I may, I would like to follow up on the concerns regarding Arogya Setu, which is the contact tracing app that is being used in India. So to my understanding, the app is not just for contact tracing, but it's an all-in-one app. So users are given color-coded badge showing infection risk. It gives access to telemedicine, e-pharmacy, and diagnostic services. So the concern is that the more services or functionality there are that are offered in the app, it could mean that more data is being collected. And also, I think we should be concerned when these apps are being deployed in jurisdictions where there are no data privacy laws. So in India, for instance, at the moment, there is no national data privacy law. And also to mitigate trust issues. And, there was a survey recently that was conducted among, I think, 4,500 Americans that found 50% would not install apps that they don't trust. So obviously, issues of trust is very important to address. And this is where sunset clauses or an expiry date of when the app will be used is very important, as you and Rahul has pointed out. And also to make sure that the app is open source. And this means that the code and the methods behind the apps can be independently verified.
Rahul, do you want to pick up on some of that criticism of the way that India is using app technology to help COVID-19 tracking?
Sure. So look, I never hinted that the app was only contact tracing. I said it does plain vanilla contact tracing. It does three things, actually. The first is it provides communication and it provides access to what we call convenience features. Look, this is a desperate time. We've been in a lockdown for almost 2 months. There are people have mental health issues. They need to get in touch with doctors. There is a feature to get access to telemedicine, but that telemedicine is completely outside the app. It's a link that takes you to a different place. The app does contact tracing. It does provide you the green, yellow, orange badge, which essentially is the feature of all contact tracing. And it does a third thing, which we haven't mentioned, which I think is extremely important, and that is what we call syndromic mapping. It picks up people's symptoms, and then it picks up completely anonymized signals of people's illnesses. And if it can identify a heat map of disease clusters that are developing, it has the ability to actually identify clusters of disease even before that actually happens. And the data is showing that Arogya Setu has identified 130 spots, clusters, between 3 and 17 days earlier than the medical officers on the ground found it. And of course, you can imagine that that can be tremendously useful by getting medical resources down to the ground before it actually spreads too much in the community. So yeah, I mean, it does these three things, but it's in the context in which it's been designed, and the data is showing that it is successful right now. I have said that there are privacy provisions built in, and I think those privacy provisions address the safeguards, even though, as Irene says, we don't have a privacy law. I mean, we don't have a privacy law. We have to build the app. How do we do it in the most privacy-preserving way? I mentioned the three things that we've done, which are built into the design of the app, which I think will address those concerns, even though we don't have a privacy law.
Okay. Oh my goodness. There are so many concerns online right now. First of all, let me start off with this, Dr. Anu. I want to put this to you, which were polls done in the US, in Canada, in the UK. How many people would actually download a coronavirus contact tracing app? And not that many people were happy about doing it. What would you say to them, Dr. Anu?
Well, I think the issue is that upfront we need to figure out some of these questions that Irene and Rahul are pointing to. How can we do this in a privacy-preserving way? And I think that concern has to be figured out. And I don't think that's, at least in the US context, been clearly figured out. And once it's figured out, it also has to be then publicized and promoted to the public in a way that they can understand, as Irene was pointing out, the code behind all of this, so that we can really know what goes into it, so people can garner that trust in the app. So I think none of these things happen from day one and go to scale. But I think we need to figure out some of those questions first and foremost. And like I said, if we can't do that, then we shouldn't be pushing the app. We should do it when we can actually do it in a way that's safe and that preserves privacy. And then secondly, people can trust. So, I see those numbers. I think if we figure out solutions to some of these questions in a way that we can then promote it to the public and people see it and try it and understand the value of it, I think you can see those numbers grow. But I think we're still at an early point in this. I think, right now the focus really should be getting the manual tracing systems upon which this type of app technology could really work well in place first. Secondly, I think as we start building out these apps, to me, it's not something that should go to scale right away. I think we need to actually trial it out, work out the kinks, understand what the pitfalls are, especially around some of these questions and concerns that people have. I think if we do it in a staged manner, that doesn't have to be over years, that can be in weeks to months. I think we can do this in a way where it actually works. And you also do it in a way that builds up the trust that people will need for it to actually go to scale in a way that's effective.
Yeah, that trust is really important. Let me show you something that's just happened in Qatar. Qatar now will have a mandatory tracking app. And this tweet here is from the Assistant Foreign Minister, the spokesperson. This is the app. I've seen something quite similar in China as well, where you actually use like a Q code there. I'm just going to tab through a couple of things. This is one of my colleagues, Peter Dobby, and he's showing here what it looks like. So he's already got his code. Apparently you need this code in order to go outdoors. And then the permissions. This is Justin showing the permissions that you need to give: location, your phone, your storage, your disable your screen lock. It goes on and on and on. Irene, are you worried that apps like this that say you need this to stay healthy, we need to do this to fight COVID-19, are you concerned that this is already happening, that people have so many questions, but it's already happening around the world?
Yes, absolutely. I mean, watching, seeing the list of permissions that are required is already giving me anxieties, let alone if I have to personally download it. I mean, I think there are a number of organizations out there that have given recommendations on the best practices of contact tracing apps. And number one on those lists are typically that apps must be voluntary, that people should not be forced to download the app, right? And by forcing people to do so, again, it would undermine trust, because naturally people would be suspicious. Like, why do I have to download this? Who has access to this data? How will my data be stored?
I mean, you make a good point, only just because Jack Walsh is on YouTube right now watching you. And he says, what if we refuse to download the app? What then?
Exactly. And that is definitely a concern, especially in jurisdictions where, they are known to have very repressive governments. If we think of the situation in the Philippines, where President Duterte has issued a shoot to kill order for people who violate lockdown measures. And if you imagine contact tracing apps, location tracking being implemented alongside the shoot to kill order, plus maybe, facial recognition. I mean, the amounts of human rights violations that could happen as a result is just unimaginable. And certainly we want to avoid a situation where we have a human rights crisis that persists beyond the health crisis.
I want to just do, before we end here, is to bring in a collection of doctors who see how helpful technology can be. And they're definitely pro technology helping COVID-19 tracking. Have a listen to their thoughts.
Digital tools and technology could be really useful in the response to COVID-19. We're looking at using automatized SMS questionnaires in parts of West and Central Africa where people use SMS quite frequently. In responding to those questionnaires and explaining what symptoms they have, we're hoping to identify people with signs of COVID-19 at a much earlier stage.
We see, for example, in the body temperature tracking devices used in front of hospitals and some public stores, where people who are exhibiting some symptoms, probably from coronavirus like fever, are asked not to enter those public places.
If the data is available to all of us, think about how it will empower those lower income workers, healthcare workers, that perhaps need to ride public transportation to get to work.
So much still to debate and discuss. Irene, thank you for being in our discussion. Thank you for being on the stream. Rahul and Dr. Ranu as well. Let me leave you back here on my laptop with the COVID tracking tracker from MIT. They're asking for your help to help track other trackers around the world. I'll leave you on my laptop. Thanks for watching, everybody.